Hello, this is Kim Jungle. Part 3 of Orthodontic Differential Diagnosis will discuss space gaining methods for non-extraction treatment. This is a list of the space gaining methods that I use. There are 6 methods which are 1. Uprighting, 2. Dilatation, 3. Expansion, 4. Advancement of incisors, 5. Reproximation, and 6. Occlusal plane change. The required arch length and the arch length that can be gained by these methods are compared to evaluate the possibility of non-extraction treatment. 1. Uprighting. The amount of attainable uprighting can be assessed by model analysis. Space can be gained by uprighting mesially inclined teeth, and 5 degrees of uprighting can provide 1.5 mm of space. If the teeth are upright as in a flat curve of Spee, there is a limitation to the amount of posterior movement. On the other hand, space can be gained by uprighting the mesially angulated teeth in a deep curve of Spee. Every orthodontist flattens a deep curve of Spee by leveling. Some may do so as in this red line, and others as in this blue line. In either case, the curve of Spee is flattened. But how do you want to flatten the curve? In MEAW, the curve is flattened as in the blue line. MEAW archoir has loops between the teeth from the distal of the lateral incisor. Therefore, there are 5 loops in a non-extraction case and 4 loops in a premolar extraction case. 5 degrees of tip-back activation is applied sequentially from the second loop, so that the added amount of activation is 20 degrees in the last loop in a non-extraction case. In other words, 6 mm of space per side can be obtained in a non-extraction case. And in a premolar extraction case, despite the mesial angulation of the molars due to space closure, 15 degrees of tip-back activation can provide 4.5 mm of space per side. 2. Molar distalization. The amount of attainable molar distalization can also be assessed by model analysis. In angle class 1 molar relationship, the mesiobuccal cusp of the upper first molar occludes with the buccal groove of the lower first molar. When the lower first molar is mesial to the upper first molar, it is class 3, and when it is distal, it is class 2. As you can see, 6 mm of space can be gained in the upper arch in full class 2 relationship and in the lower arch in full class 3 relationship, and 3 mm of space can be gained in half class 2 or 3 relationships. 3. Posterior available space. PAS is the space between the distal surface of the lower second molar to the anterior border of the ramus, and it can be evaluated in cephalometric and panoramic analyses. In Figure A, there is a sufficient PAS. In Figures B and C, the lower third molar can be either erupted or impacted. Since there is a sufficient PAS, space can be gained by the extraction of the lower third molar. On the other hand, in Figure D, there is not enough PAS, so the extraction of the lower third molar cannot provide any additional space. Aesthetics should also be considered when evaluating PAS. In this patient, since aesthetics is acceptable and the crowding is not severe, PAS can be utilized by the extraction of the lower third molars. On the other hand, this patient has protrusive lips. Of course, the lower third molars can be extracted to gain space, but aesthetics will not be improved. In this case, premolar extraction should be considered since the discrepancy lies in the anterior region. in order to improve aesthetics. 2. Molar rotation. The buccal surfaces of the upper left and right first molars should be parallel. But in many cases the upper first molars show mesial rotation of buccal cusps around the palatal cusps as axis. 2. 1. Derotation and tarotation. These mesially rotated upper first molars can be rotated to the opposite direction, and the rotation can be assessed by model analysis. Space can be gained by the derotation of the mesially rotated upper first molars. In addition, the derotation of the second molars can increase the arch length and provide space. 3. 1. Expansion. Space can be gained by the transverse expansion of the arch, and the measurements like TPW and ICW can be evaluated in model analysis. According to Atkins, the lateral expansion of posterior teeth by 1 mm increases the length of arch perimeter by approximately 0.7 mm. In general, expansion screws are installed in expansion appliances. Each turn of the screw results in 0.25 mm of expansion. In rapid expansion, the screw is turned once or twice per day, while in slow expansion, the screw is turned twice or 3 times per week. The amount of expansion is larger in rapid expansion in the initial stage, but the total amount of expansion is similar between rapid and slow expansion during retention. One of the advantages of expansion is the treatment of posterior crossbite. It shows the normal relationship of the upper and lower molars with normal buccal overjet. She shows the full crossbite, where the upper molar is about 6 mm lingual to the lower molar negative buccal overjet. In half crossbite, the upper molar is about 3 mm lingual to the lower molar. If the posterior crossbite is unilateral, there is a high chance of midline deviation. In a unilateral full crossbite or a bilateral half crossbite, 6 mm of expansion, excluding overcorrection, is required, and this results in 4.2 mm of gained space. In a bilateral full crossbite, 12 mm of expansion is required, and this results in 8.4 mm of space gained. In other words, this means that in case of a bilateral full crossbite with mild to moderate crowding, 3.2 lateral expansion of the lower arch can be achieved by the correction of buccolingual inclination. In general, constriction of the upper arch results in posterior crossbite. However, this does not occur in many cases, and rather the lower dentition is lingually inclined as well, and space can be gained by buccoversion of the lower dentition. Let's evaluate the vertical dimension. Here you can see that between blue and red, red shows the more severe class 2 malocclusion. In order to compensate this malocclusion, the vertical dimension decreases, and this is known as the vertical compensation in class 2 malocclusion. Then what about the position of the incisors? The incisors become labially inclined and the interincisal angle decreases, leading to protrusive lips. Should the premolars be extracted? If the vertical dimension is decreased in this case, it has to be increased. 3.3. Increase of the vertical dimension should be considered in non-extraction treatment, and aesthetics should be evaluated. In class 2 malocclusion, the profile at edge-to-edge bite is assessed. If the profile is acceptable or improved, non-extraction treatment can be performed by increasing the vertical dimension with forward movement of the mandible. 4. Advancement of lingually inclined incisors can provide necessary space. The amount of advancement can be assessed by model and cephalometric analysis. This is a patient with class 2 division, 2 malocclusion and mild anterior crowding. The upper incisors are severely retroclined with yuan to FH of 85 degrees. In order to achieve normal inclination of 114 degrees, a labial inclination of 29 degrees is required, which will in turn lead to 11.6 mm of advancement. However, this movement is allowed only if the aesthetics is acceptable. So aesthetics, crowding, and canine-key relationship must always be considered. In non-extraction treatment, I try not to move the incisors forward, because the inevitable labial inclination of the incisors will lead to deterioration of aesthetics. 5. Reproximation. Space can be gained by interproximal reproximation, and it can be evaluated by model and aesthetic analysis. According to Sheridan, 50% of interproximal enamel can be removed so that 0.5 mm per anterior contact and 0.8 mm per posterior contact can be gained. Therefore, 2.5 mm of space can be gained by reproximation from one canine to the other, and 4.1 mm from the first premolar to the other, 5.7 mm from the second premolar to the other, and 7.6 mm from the first molar to the other. 6. Occlusal plane change can provide space, and it can be assessed by cephalometric analysis. Here it shows a half class 2 molar key which requires 3 mm of movement to achieve class 1 molar key. Either the upper molar can be moved posteriorly or the lower molar can be moved anteriorly. Besides, another way to achieve class 1 molar key is to slightly alter the occlusal plane. And 6 degrees of change is required for 3 mm of mesiodistal movement. According to Braun on the relationship between occlusal plane and dental occlusion, each degree of rotation of the occlusal plane will result in a ½ millimeter changes in the dental occlusal relationship. So 3 mm of changes in the dental occlusal relationship requires 6 degrees of rotation of the occlusal plane. In a case of full class 2 molar relationship, conventional orthodontics attempts to move the entire upper dentition 6 mm posteriorly by the use of miniscrew, which is not quite easy clinically. Then how should we treat? MEAW orthodontics first alters the molar relationship to half class 2 by moving 3 mm, which is not too difficult, and then changes the occlusal plane by 6 degrees to achieve class 1 molar key. Steep occlusal plane can be rotated counterclockwise, and flat occlusal plane can be rotated clockwise to achieve a normal occlusal relationship. 6.1. Steep UOP is closely related to a deep bite. Many orthodontists attempt maximum intrusion of the upper incisors while leaving the upper molars in the same position, which results in an excessive intrusion of the upper incisors. Or in some cases, as in C, the upper molars are extruded while leaving the upper incisor position unchanged. However, as in B, a counterclockwise rotation of UOP by the simultaneous extrusion of the molars and intrusion of the incisors can be helpful in improving the occlusal relationship. An appliance mainly used in case of a steep UOP is an intrusion arch. And in MEAW orthodontics, double archway is used as an intrusion arch. There is a main arch wire that is engaged in the upper molars and a sectional arch wire for the upper 4 incisors. The upper incisors are intruded and the upper molars are extruded, thereby flattening steep UOP. Here is a case with steep UOP of 16 degrees, so there is a 6 degrees of difference from normal UOP. By changing the steep UOP of 16 degrees into 10 degrees, 3 mm of change in dental occlusion can be achieved. In other words, it means that this 3 mm of change can turn a half Class 2 relationship into a Class 1. 6.2. Steep POP means a POP of more than 15 degrees. This steep POP can be flattened by uprighting the molars, and as a result the mandible can be further moved forward. Here is a case with steep POP of 16 degrees, so there is a 6 degrees of difference from normal POP. By changing the steep POP of 16 degrees into 10 degrees, 3 mm of change in dental occlusion can be achieved. Therefore, the presence of steep UOP and/or POP indicates a better chance of gaining space. Let's review the space regaining method. 1. Uprighting 2. Derotation 3. Expansion 4. Advancement of incisors 5. Reproximation 6. Occlusal plane change. With these methods we can gain as much space as possible. Non-extraction approach should always be considered as a primary option. If it is impossible, then extraction treatment can be considered. Thank you for watching.